Sometimes the toughest part of using a prosthesis is not the physical hurdles, but the mental ones. Christine Hill with Sunshine Prosthetics. I'm a certified prosthetist orthotist, also known as the leg lady. I care for amputees, people with limb loss. Even if you don't have any personal experience with limb loss, you may have some personal experience with either depression or anxiety yourself, or there's someone that you care about that struggles with depression and anxiety. These are just two things that have come up lately in my journey of caring for people with limb loss. When it comes to limb loss, it is often described as the same grieving process as if you had lost a loved one or facing a terminal illness. The Kubler-Ross Theory, but I'm sure you guys are familiar with more generally the 5 stages of grief. So first we have denial, second we have anger, third we have bargaining, fourth, we have depression, and then fifth, final stage, we have acceptance. And the main thing, we're going to be talking about depression mainly today, but one of the main things I want to point out and for everybody to realize is that this is not a straightforward linear process. Whether you're going through limb loss or have dealt with limb loss or just struggling with depression and anxiety, or you care about somebody that's struggling through depression and anxiety and you're trying to figure out how to help them, understand that this is not a straightforward linear process. They are not going to go through denial and be like, okay, I'm done with the denial stage, now I'm going to jump into anger, work through that, okay, now I'm done with the anger stage, and then move along, to acceptance and then be fine. A lot of times you'll see they might jump denial and anger and bargaining and go straight to depression, or they might work this circle to acceptance and then later on experience some of that denial and anger. Everyone is on their own journey, and that this is not a straightforward, easy, or linear process. Another disclaimer, I'm not an amputee. I've never faced limb loss personally. So if you are someone who has, I would love to, if you're open to sharing your story, would love to know your story or some of your personal insights into some of this. Because like I said, I don't have any firsthand experience with depression related to limb loss, but I've seen it in the patients that I care for. Recently had a patient who had an amputation above the knee, and since then he has been really struggling with seeing himself as a whole person. And when it comes to physically using the prosthesis, he does great. When I'm working with him or physical therapy is working with him, he does great, but he cannot find the motivation to use it at home or do anything with it on his own. And it was really heartbreaking to see, working with him in one of his therapy sessions, that they had a mirror in front of him. You can just tell how difficult it was for him to look at himself in that mirror. And that is one of the main things that I want to point out is you are not less than. You are worthy. You are valuable, and you matter. And I know that might be hard to believe, but you are worthy, you are valuable, and you matter. The other thing that I want to talk about related to this is anxiety, because that's been another thing that's come up as well with one of my patients, a transfemoral patient as well. When I first started working with this patient, very, very high anxiety. She had a previous prosthesis, had a bad experience, but was open to trying again. But like I said, very high anxiety. And when we initially tried to fit her prosthesis and deliver it, she was just having a very difficult afternoon. And it was hard for her to calm down. It was hard for her to communicate. And so we just put pause, we'll visit this again tomorrow, it's fine. Some of the key points that I want to make, if you are someone who is currently struggling with depression and or anxiety, whether it's related to limb loss or not, is it's okay to not be okay, and to just give yourself grace and kindness while you are on your journey. And if you are someone who might not necessarily struggle with depression or anxiety, but you care about somebody who does, be patient, be kind with them, just be with them during their journey. Want to encourage anybody and everybody to, you may have seen the tagline on my banner, create some rays. So what that's referring to is just making someone's day a little bit brighter. You know, whether it's a smile or a kind word, whatever it may be, as you're going throughout your day, because you just never know what someone is going through. Just spread a little ray. Spread some rays today and just make this world a little bit of a brighter place.